Happy Wednesday, everybody. I'm Jen Rumbalski, the director of the La Crosse County Health Department. I'm very excited about our media briefing today. We have a number of, I think, positive things to share. So I'll start with the case counts, and then we're going to talk about the launch of a new initiative. And then I'll give an update on where we're at with the Compass, as well as some other reminders about our testing site coming up, and some tweaks to the Outbreaks and Investigations page on our website. So to start with the case counts, we have today so far in La Crosse County 15 cases, and that brings our total to 536. Our total negative test results is 13,253, which means our percentage of positive cases over the whole time period since we had our first case is 4%. We still have one individual who is hospitalized, and we remain at 0 deaths for La Crosse County residents. So we're really pleased about that. Our number of cases that we have recovered is 348. So that is a total of 65% of our cases have recovered. That is higher than it's been in the past. So we've been able to recover some folks. They've gotten better, and we've been able to increase that number significantly. In the state of Wisconsin, our total number of positives from yesterday to today is up 598. In addition, we had 10,138 negative tests over the last day. Ever hospitalized in the state is 3,683. That did go up by 44 from yesterday. So that is a larger number than we've seen in the past. And our total number of deaths is currently at 807, and that went up 2 from yesterday to today. The breakdown of the 15 cases that we have so far today, we have a mixture everywhere from 15 to 50s, and then someone in their 70s. 7 of the 15 are in the ages of 20 to 29. So next, I want to introduce a special guest with us and just express sincere gratitude. Libby Weber is with us today from the Weber Group. And Libby, I really appreciate you being on with us today. We reached out to the Weber Group a couple of weeks back and asked if they had some ideas for how we could recognize businesses in a positive way if they were taking using the guidelines and had good practices in place. And Libby and her team were just so wonderful to work with, and we're proud to launch a collaborative initiative today. So I'm going to let Libby talk a little bit about that. Thanks, Libby, for being on today.
Thanks, Jen. It's great to be here, and thank you for giving us the opportunity to be part of this. So it's been a couple of very busy weeks for both sides of the team, and we're really excited to announce an initiative really kind of putting a lot of responsibility within the business community for La Crosse County. We have what is called now checkthespread.org, and that has been put together in collaboration not only with the County Health Department, but also Downtown Main Street Inc., Explore La Crosse, the La Crosse Chamber, LADCO, as well as Gunderson Health Systems and Mayo Health Systems. So it's been an amazing opportunity to see how we have all been able to come together and really demonstrate really what a greater sense of community can be, starting with what influence the business community can do for the overall well-being going through this pandemic. It's pretty much without any misinterpretation that it's been very frustrating to run business during the pandemic. And regardless of the size of business that you run or work in, the industry, there's been a lot of frustrations, a lot of fears, and a lot of, I think, lack of confidence in business operators to really know how to best make decisions that's not only for the well-being of our consumers, but also our employees. And so the initiative for checkthespread.org first kind of centralizes a lot of resources that are available. And depending on the industry that you work in or any of the business organizations that you might be a part of, it's not always easy to interpret or really know how to apply a lot of that information. So we wanted to centralize a lot of resources, not only for business operators, but also employees and consumers to kind of get a better big picture understanding of how to make good decisions so that we can stay in business safer and smarter. But really what the initiative wants to accomplish is asking and inviting the businesses in our community to make a pledge that commits to a high set of standards in operating your business at safety and health measures that helps ensure employees are comfortable coming to work and your consumers were building that confidence. You know, living with coronavirus and operating a business with coronavirus is not going to change. We're adapting to that. And so really, how can we best support our community, specifically the business community, and making those better decisions so that we can move forward with all the resources that are out there. And so by making a pledge, we really want to focus on the positive of who's doing what and taking that responsibility, which is really a shared responsibility with business operators, the employees that work there, and of course our consumers. So we're really excited that today the website is live. There's a lot of information on there. Again, it's checkthespread.org. And I would just really like to thank all of the partners that have so far been an active role in really developing what it's turned into. And so, yeah, we're open, we're ready to go, and we're hoping that all of our businesses find a lot of value in what's been put together and can make that pledge so that we can continue to move forward in a positive direction through this pandemic era.
Thanks, Libby. And breaking news here is that we have another partner in the Tavern League has signed on. So that is really exciting. We're glad to hear that. So thank you to them for being partners as well. I think it is gaining momentum. It's really exciting to be able to recognize businesses in a positive way. You know, we've said that this whole thing is about decreasing risk with the spread of COVID-19, and that is both on the health side as well as the health of our community, which includes having healthy businesses. And I just think that's so important to do our best to balance that. So really, again, grateful to Libby and her team and those on my team who have worked really hard on this, and also all of those partners who are coming to the table. It's been such a really positive collaborative effort, and we're looking forward to having businesses pledge and being able to indicate that they are doing the right thing with those guidelines. You know, we really believe that by developing a safer environment, we'll have safer businesses, and that will lead to a safer economy. And it will help our residents feel more comfortable when we're able to be out and about safely, that the businesses are doing their best as well to keep those environments safe. So it's just a wonderful initiative all around, and really excited about it. So thank you, Libby, so much for being on with us today. So as Libby indicated, Check the Spread is www.checkthespread.org. Go ahead and look at those guidelines. And if you're doing those guidelines, take the pledge and we'll get you connected. So the next item that I want to talk about is relating to the compass. So our compass has updated. We made that update just today. And I just want to talk through a couple of things here with regards to the compass and the website. First and foremost, we have moved from red to orange, or from severe to high as of today. So we are excited about that. We want to make sure that we stay in orange and not move back to red next week. Just a note of caution that we do think that there has been some delays in testing. We have learned that There were delays over the weekend with a couple of different issues through our local healthcare systems and the testing pieces. So we have heard some delays in coming in. So it's possible that we may have additional cases in the next couple of days as those results come back. But again, we are excited to see us and the data moving from severe to high risk, from red to orange. Please continue to take all the precautions that you've been doing. Again, if you have not started wearing a face mask in public when you're out of your home, now is the time to start. It is the single most important and easy thing that we can do to decrease spread of this virus. So really important. If you haven't done that, now is the time to start. Other things that I want to mention on the website, just wanted to note that a couple of new features are on there. So first of all, if you look under the, there's a tab in the website that says case data. So that case data tab has some new features in it. It is up to date as of the data that we've gone through as of July 7th. So just know that each of those data points will tell you the total number of the cases that we've been able to get through. So for example, we have 536 cases so far. We have age and gender information as well as race on 518 of those cases, severity, origin, and public outings and in municipalities. Or actually municipalities is also 518, but the others are in the 300s, which means those are data points that we have to dig through our electronic disease surveillance system data to pull out. So we're working really hard to get that data out so we can have that more up to date. But this is the latest information that we have. So take a look at that information. I'll just note on there that we do continue to have about 47% of our cases originating in either community spread or through close contact. We have a lot of the cases that are mild symptoms. And then we also have that about 38% of our cases have been in public prior to symptoms beginning, which we know additional information keeps coming out about the infectious period being up to 48 hours before symptoms begin, and that they can be spreading during that time. And then the before and after, folks that have been in the community before and after symptoms is 27%, and then after symptoms is 7%. So only 28% have not been in public before or after symptoms beginning. So we would really like to see that percentage be higher for not being in public, because that is how the virus spreads, is when folks are in public. If you look at the epidemiology status page on the website, there are a couple of features there as well. There's a new graph that is titled number of COVID-19 tests by day compared to the 7-day rolling average for percent of positive tests. So that graph is meant to really help you understand that the number of tests is not the reason for our increase in positive cases. So if it was true that testing was the reason, which it is not, then cases would go up as testing increased and the percentage of positive would not change. So the fact that the percentage of positive has gone up really proves that it is not related to the increase in testing. Another feature that is added to the website is under both the current status and recommendations, as well as the isolation and quarantine pages. There is now a map that shows by county across the nation the case rate that is occurring by county. And the map really looks at La Crosse County as the index county, and then it tells you if the counties across the nation are above or below, and how much above would be yellow or red. And if it's below the rate currently in La Crosse County, it would be green. Now, green doesn't mean there's no risk. It just means that the risk is not as high as in our county right now. because we are seemingly just coming out of a surge, our case rate is higher now than it had been, 3 to 4 weeks ago before our surge started. So that also means that if you travel outside of our county beyond, going from work to home, then you could be bringing risk to another area that you're traveling to as well. So if you must travel and you want to do that as safely as possible, identifying those locations where risk may be greater than our index county of La Crosse County is a helpful tool for you to be able to know if you're driving or if you're going to a location that is not green. You will want to take additional precautions, and quarantine upon return will be the best practice that we would recommend. And we do have a couple other features on the website as well that you may find helpful. But I did also just want to say that we updated some of the current status and recommendations tables, including specifically the schools. So you will see that that has been updated. So those are some of the features added to the website relating to the Compass. Next, as far as reminder about the testing site. So we've talked about that we're working to have 3 additional National Guard testing sites between now and the middle of August. Our first one is this Friday from 10 to 6, and that is at Logan High School. Just a note that it is not the deeper swab, it is the nasal, not the nasopharyngeal swab. So if folks are worried about that deep swab test, that is not the one that is used at the National Guard testing site. So please plan to come to that site if you can. We're also working to finalize details for an event in Alaska on July 24th. So we're just waiting for final approval on that one from the National Guard. And when we have that, we'll let you know more. And then we're working on another site in the beginning of August back in downtown La Crosse. And we're still working on finalizing details. Wanted to talk a little bit about another aspect of our website, which is the public notifications or the Outbreaks and Investigations tab on our website. So as is really our process with everything, we are continuously improving and working to make all of our processes better. One of the things that we have been able to tweak on this site is the flow chart, which is the tool that we utilize to determine the level of risk that a business has if they have had a confirmed case of COVID in their establishment. And we want to make sure that we're being really careful in determining that risk level and trying to reduce any subjective or judgments that might be part of that process wherever possible. So for example, if a facility has a case associated with it and it is not open to the public, then it would not be a public risk. So you'll notice that if you open that flow chart under the learn how we decide that an establishment should be low, medium, or high risk, if you click on that link, you can see the flow chart there, and it will tell you that is the first question that we'll ask about any given establishment, because if it's not open to the public, then really that is a direct communication from our department with that business to help reduce risk and to identify all who are in the business that may have been exposed. So it really starts first and foremost with, is that business open to the public? Can public access it? So I think that's one of the improvements, and there are a couple of other pieces as well that have been adjusted in that flow chart. We also heard, and again, we appreciate feedback that we get from all of you, and we heard from some of our businesses when we made the change to no longer call the businesses that were going to go on the low or medium risk, that was not as helpful to them. And we really decided to change that back. And so we will attempt at every possible ability that we can to make contact with those establishments, no matter what risk level they're being placed under on the website, And really that's been very promising for us to connect with businesses because we've been able to, go through kind of an assessment process of over 60 businesses already as a part of that process. And I think that's really a great way for us to communicate and help decrease risk in our community. And then lastly, I just want to mention that there have again been lots of questions in light of the recent announcements we've heard about from locations near us, such as the city of Rochester, the city of Winona, and Madison-Dane County, who have moved forward with orders relating to masks. So I just thought that it would be helpful to address that again. And I think it's important here to just reiterate that this is difficult, this is frustrating, that we're still sort of in this place where we are not certain about the authority that health officers have under state statute relating to particularly general applicability orders, meaning a county-wide order, for example, about masks. So because of that, there is a statewide committee that is nearing the end of their analytical review of the legality and the guidelines for health officers and health departments. And we are eagerly awaiting that body of knowledge product that we hope will get out of that. In the meantime, I think it is important to note that I just today sent out a communication to municipal leaders, a number of municipal leaders to find out if there is interest in looking at ordinances at the municipal level. So that is something that has been done with things like tobacco-free air laws, things like that. And there is the ability to work through it in that process. Hoping we can have a communication about that with municipal leaders. In addition, I think there are a number of things that we've been doing to include the business recognition program and check the spread, to include the Outbreaks and Investigations page on our website, where we're working hard to notify the public about locations of risk, including the contacts we've had with businesses and helping them to improve their processes through over 60 businesses and assessing those businesses with their practices. And we're also working to develop an initiative that will engage the age group that has been significant with the numbers of cases, which is the 20 to 29-year-old age group. So we're looking to engage them in a strategy to increase mask wearing in that age group. And that will be we'll be working on that through the month of July. So I am concerned about the fall when we have students coming back on campus, the risk level associated with the spread among that age group and how that ripple effect impacts the rest of our community. So I just want it to be very clear that I am not taking no action. I am taking actions, and that as soon as we understand more about the authority relating to health officers in the state of Wisconsin, we'll continue to work and do everything we can to protect the public. So I am moving forward with some of those pieces. I also want to clarify that I do have the ability to write health orders, and I have written health orders in the past. So here are some of the situations where that would happen. On an individual level, if a case, a lab confirmed case, has not responded within 24 hours or so of our initial phone call attempts, email attempts, maybe texting, and we leave messages saying who we are and that we need to hear back from them within 24 hours, we can send a health order, and that order will say, this is the reason why you need to contact us back, and here is the repercussions if you do not do that, where we can cite someone and they would get fined for not working with us to try to get at the information that only the case can provide for us about contacts, about locations in the community where they may have been. And so we can and have sent orders for those situations, as well as if an individual who's a confirmed case refuses to give us contacts. We can also do it in a situation where we have a significant amount of evidence that a specific site, maybe it's a business, maybe it's a different type of location or an event, is not taking the practices that they need to be taking. And again, we really try first and foremost to educate. And if that doesn't work, then we do have the ability to write an order to a specific site. So I will be partnering with others in the community to include, other public officials to help me have the information needed about locations that are really not supporting the overall goal of decreasing the spread of COVID through the precautions that they may or may not be taking. So hopefully that helps. At this time, though, to be really clear, we do not feel we have the authority to write a county-wide health order. But again, we're trying to get at that through other means until we have more information from the final analysis of that study committee at the state, which hopefully should conclude within the next week or two. So with that, I think I will take questions.
Hi, Jen. So the committee that's working on the research that you would then be able to take action for, do you have any info from them about when a broad mandate and taking action for public safety would outweigh just continuing with what we're doing now?
Yeah, I mean, that is exactly one of the questions that that committee is meant to respond to. And actually, we've asked them, we have a representative from our county who sits on that committee, and the question was asked that they specifically address the countywide mask order so that it is much more clear about where the authority lies. I do just want to note that there are some other considerations to be aware of. So let's just say, for example, that I did have the authority to write a countywide order about masks. I think that the enforcement of such an order would really be a challenge because our ordinance allows for civil penalty only and not criminal penalty, which just means that we write an administrative citation and that law enforcement does not have to enforce our ordinance. So the enforcement of a countywide order in that regard can be very challenging and can have unintended consequences that we also need to think through as we balance the value of writing an order that may not be adequately enforced. So I think there are a lot of considerations, and I can assure you that I am thinking through those all the time. This is something that I take very seriously, that it is really important to me that I do and my department does everything we can to partner with others to decrease risk wherever we can.
So what do you think it would take to give you the confidence to write an ordinance like that?
Well, again, I don't know if that is the best route for a county-wide ordinance or order from the health officer. I think it's one route. There's another route, which is what I was hoping to speak with municipal leaders about, and we'll see what they feel is, if they feel that that's important and they want to come to the table, then we could look at municipalities passing an ordinance around the same type of language like a mask order. So there are a couple of options, but ultimately, I think we are awaiting the results of that analysis to understand better what that balance is and what the risks are, both to me and to us and to the public, particularly with a lot of considerations to include enforceability. So I wish there was an easy, straightforward answer. Unfortunately, the general applicability orders are really not yet well understood. And I think I will just honestly say, that we see in Minnesota, those are cities that are taking those actions. The Madison-Dane County order is a city-county health department. I don't know if that comes into play. I think that's really where those that have strong legal background, as well as being paired with those that have health backgrounds on that committee. That's the reason why that committee is there, and their work and their product will be important for us moving forward in the state.
Will you just explain who's on the committee right now who could make that decision?
Who's on the committee? So this is and I don't have the list in front of me. I could get that to you, Marcus, but this is a Wisconsin Counties Association led committee. There is membership from the League of Municipalities, as well as there's another organization. I don't have it off the top of my head. I'm not sure. And then also the Wisconsin Association of Local Health Departments and Boards. So that's where the health piece comes in. And each of those players has representatives on that committee. And really there are folks that have strong legal backgrounds that will help. Corporation Council, also there's an organization related to corporation councils that has individuals on that committee. So I don't know how many, but I'm thinking it's around 10 that are on that committee, and we haven't seen a final product come out from them yet. So we're really just awaiting what that analysis, what comes from that analysis.
And I know I've been asking you that same question for weeks. So how long have they been working on it? How long have you been waiting on this?
Yeah, that's a good question. So they started, I think, in early June, Marcus. They've only met maybe 4 times. And I think they were hoping to complete this week, but they postponed that meeting to next Thursday. So again, I'm hesitant to say that the final product will come out and be approved on Thursday of next week, which is why I'm giving the range of maybe 1 to 2 weeks, because I don't know exactly when that committee will finish its work.
Jen, Tyler Job from WKBT is asking, is it more challenging for La Crosse County to issue a mask mandate because there is no city health department?
I don't really know the answer to that. There are facets of this that I am really unclear about. I'm not sure why some counties have been significantly challenged with lawsuits relating to an order, and others have not. I think that is why that committee is so critical. I am not a lawyer. I just want to understand clearly what my authority is so that I can do the right thing for our community. I just want it to be really clear that I'm not making a choice to not take action while I have been waiting for this decision so that we are clear about what that authority is. I also have been doing a lot of partnerships and communications and obviously, recommendations. But we've been working on a strategy, knowing that the data shows us that the 20 to 29-year-old age group is the most heavily impacted, and that we can attribute that back to specific locations in some points. But the cases came in so fast and furious, it took us a couple of weeks to really figure that out from the data that was coming through. And by that point, some of those establishments had already closed. So I think it's been, for a number of reasons, it's been challenging to know what to do in the way of an actual order that could make an impact that would be positive for the goal of decreasing cases and spread of COVID-19. But I have taken actions. I think everywhere that we can, we've been as transparent as possible to make sure that individuals in our community are aware of the risks and the locations where a confirmed case has been. And we continue to work on this strategy on both the business side, hence the recognition program and wanting to raise up businesses that are doing the right thing, as well as engaging the target population that has been, the highest number impacted and potentially spreading. and impacting others in our community to try to increase mask wearing. And just because I can't at this time order a countywide mask order doesn't mean that, again, this is, in my opinion, the single most simple and easy tool that we are not maximizing in our community. It would be so wonderful to see that everyone who is going out is wearing a face covering. This is not political. Wearing a face covering is not political. It is based upon the understanding of how this virus spreads, and it simply stops the droplets from spreading to others. And it's just, it's one of the tools that we are not maximizing. So that should not take an order to require everyone to do that. But if it does require that, we are going to have those conversations. So, I just want to reiterate that this takes everyone working together. This is not just, let's wait for the county health department to figure out if their health officer, myself, can write a countywide order. This is a partnership, and we all need to care about the spread of this virus and the impact that it has on our community. So I would just say that there are things we can be doing while we wait this 1 to 2 weeks for the final product from this analysis to come out. And we have been doing a lot from our department's side and working with our partners. And, we don't have to wait for that for all of us to decide we want to wear a face covering to protect our neighbors and our family members and our friends.
Which city municipality leaders are you working with for that alternative action?
So I'm starting with the larger ones, which are the city of La Crosse, the city of Onalaska, the village of Holman, and the village of West Salem.
And Jen Tyler Job from WKBT asks, why doesn't the city of La Crosse have authority to issue a mask mandate?
Yeah, I think there's some confusion there, and I want to talk with Mayor Cabot about that. I think that what they had asked Corporation Council about at the city was under statute 252, which is the statute that is communicable disease and where the health officer authority comes from. And since they don't have a health officer and they can't have one at a city level, they had felt that they maybe couldn't take that action. But again, there are a number of, cities and municipalities write ordinances. That is something they have in their purview. So it wouldn't be under 252, but they could choose to write an ordinance, and that's what I want to work with them on, so that we can all be on the same page about what should that look like? Are they willing and interested in moving that forward in their municipality? How can we enforce it? All of those questions to really make sure that we're serving our residents to the best of our ability.
We do have a question from someone on Facebook. They're wondering what steps our health department takes when a business has multiple dates on the high risk locations.
Yeah, thanks. That's a good question. So a couple of those that I can think of that have been on there, for example, if it is, and this is part of what might be changing. So if it's a gym, for example, that location actually might have the ability to identify everyone who is in that facility, which means that in the flow chart, if we can identify all who were potentially exposed, then they would not be on the high risk notification list. So that may adjust, but essentially that is really about, how many individuals have been associated with a particular location. And I think back to, the second week of June, and we had our first notification about 7 facilities and a number of dates on those facilities. And we, those were already nearing the end of the 14-day time period. And we really just ran out of capacity at that time with all of the cases coming in, the volume of calls that came in. Really, we were pretty inundated in our ability to get the data, to move on that data in a way that would be, hey, should we be writing a health order relating to a specific location? We just didn't have the capacity at that point to have the evidence to do that. But it certainly is possible. And again, our environmental health team has been contacting businesses every time they are to be on the list. Unless they move from high to medium or medium to low risk, we always contact them. We try to reach them. If we are able to reach them, which many we do, then we are talking to them about, first we're letting them know that somebody had been in their establishment that was confirmed positive, because they may not know about that. It can be both an employee or a customer. And so even if a business is doing everything that they possibly can, they still could end up on that list because of the fact that we are not routinely wearing face masks. If we were, if you see in the new flow chart, it takes that into account in terms of the identification of risk level, because face coverings are known to be a tool that help decrease the spread of the virus. So we are actually helping our businesses if we are wearing face coverings when we when we are patrons of those businesses. And part of the our team in the environmental health division then contacts the business, and we have a process that we walk through with them to ask them a series of questions about the areas where risk can be lowered. And then we provide recommendations where there is potential for them to make improvements. And that team then, when they do that process, will raise up to me if they feel really uncomfortable with the way that a certain business is following or not following guidelines. And that would be a situation where we could take additional action if need be. We always want to educate first and enforce second, because we want businesses to have the chance to improve their practices. And sometimes multiple dates can be, they can be on a very short time frame. Like there could be 2 or 3 cases in an establishment within 2 or 3 days, and that means they would have multiple dates on there, but that doesn't mean that they've been a repeat offender and negligent with their practices. So just know that we are monitoring that, and we want to make sure that locations are as safe as possible. But the ultimate purpose of that whole process with public notification is to make sure that individuals who may have been in an establishment where there really is a high risk, a true high risk, that they can look at that date and know, I was in that establishment on that date, and I need to do something with that information. I may have been exposed, and then we ask you to complete the HIPAA compliant form that is linked on the website so that we can connect with you. The way that is so important for decreasing spread, because if individuals don't know they may have been exposed, and then they either don't develop symptoms, or by the time they develop symptoms, they may already have spread it to others. So it is really all about decreasing cases and decreasing risk.
Another follow-up question for masks from Tyler Job at WKBT. If there is a mask mandate at some point, would it come down to each city's decision in the county, or would it be countywide?
Yeah, so based upon the information I have right now, I don't believe that I have the authority to write a general applicability order, which means a countywide mask order. So what that would look like is municipalities that have authority to do an ordinance in their municipality would do that ordinance. We would all work together to have that process move through. The county would also pass an ordinance which would cover the unincorporated areas of the county. So that is sort of the way that you would get countywide coverage, is by having all municipalities that have the authority and the jurisdiction there to do that, pass that, and then the county as well to cover all of those that are not under a municipality. So it's not, it's not the simplest process, but it is a way to do it, and might be a better way, frankly, to make sure that that is really in the closest connection to what Wisconsin is, which is a home rule state, and the most authority exists at the most local level, which is the municipality level in the state of Wisconsin.
Go ahead,
So
Marcus.
when people see that the mayor's office in La Crosse refers us to you guys when we're waiting for a decision to be made, how do you respond when people ask you guys that?
Yeah, and that's what I mean when I think it's frustrating for the mayor. It's frustrating for me. It's frustrating for those that we serve. It's really like we have to work together to make sure that we can have better clarity around who has authority to do what. Because to point at each other, isn't helpful for our community. And the mayor and I have spoken with each other about that exact point. And we're actually currently working on, making sure that we kind of have a joint statement about, what we really are saying to the public, and making sure that we are not, we're not working against each other, because again, we have to work together. This is a fight against a virus, not against each other. So I think it really just comes down to a lack of clarity about authority, and we've got to figure that out. And I mean, that's the reason why I sent that email today to municipal leaders, as I indicated, because somebody has to take the lead. And, that's something I really pride myself on, is being a good coordinator and bringing people together to find solutions to problems that are really frustrating. So while we don't have the answer right now, we need to work for all of you to get that answer. And that's important to me. And I believe that that is important to others who are really there to serve their community. That's what we're there for. But again, you can't just look to your government to solve the problem. We are definitely working towards solutions. That's our role. But we all have a role: individuals, businesses, organizations, and government. We all play a role. And if we are not all maximizing what we can be doing, then those are areas that, we'd ask you to work on while I work on moving forward with these other solutions.
Vice President Pence held the press conference pushing for schools to reopen in the fall, and that we don't delay the start. So do you think students in our area should be attending classes in person by September 1st? Why or why not?
Yeah, thanks. That's a great question. I do think that we should be in school. I think we need to be prepared, though, for some mixture of virtual and in-person classes. And I'm really proud of our schools, the work that they are doing to plan and prepare for the fall to be as safe as possible for their faculty and teachers and staff and students is really commendable. What they have been asked to do and the changes that they are really needing to make to have that environment be as safe as possible is a big lift. And they're working together and they're working with us, and that is how we're going to be successful. Part of the challenge there too is, the level of Compass. If Compass is switching, from red to orange to yellow to orange, that will be really challenging for schools in the fall. And I also think that having individuals be in a classroom is really important for certain students. So I have kids in school. I sit on a school board. I see that there are a number of kids this past end of the school year that really struggled to engage, that disengaged really. And I think there's a lot of factors that come into play there, including if parents are working, if the level of support and guidance at home is not able to be there, if a family is struggling and the individual is old enough to be working and they have to be working. I think there are many factors that come into play with that disengagement. But I think having kids be in school, it's such a critical part of our community, and it's really important for wellness overall. But again, they have to be able to flex with where the risk levels are in our community in order to have that safe environment. And that includes having the ability to move to some form of virtual classroom, whether that's full time for a certain time period, or if it's in part where they're alternating how many kids are in for in-person versus virtual on certain days of the week. Schools are getting very creative in that planning. And again, I'm really proud of them. I think the risk levels increase when obviously when cases increase, but also when you have mixing of communities. So for example, when we have sporting events, and we love our high school sporting events in our area, but that is a place where students and parents may be mixing. We might have close contact with a number of people. And if we're in a certain risk category, that's not going to be popular to cancel extracurricular activities, including sporting events. But the most important thing here is the education of our young people and helping them to be able to continue to improve their learning. That is what's going to help them be, the best adults that they can be once they get to that point. So I think it's great that we're moving in that direction. There's a lot of planning happening, and I feel I feel positive about where that's going, and really proud of our schools.
What's your most recent communication with our schools, and with those plans you referred to, is there a deadline for a decision to be made as to when they'll be returning and how?
Yep. So I have a liaison that sits on those meetings every week. So they meet every Thursday and they talk about their plans. And again, that is all public and private schools in La Crosse County. As far as the deadline, I believe that their goal is to have something for their communities in early August about reopening. But I'm not the key liaison to that group. That is somebody on my staff. So I'd have to verify that date. But they are getting close to their time period where they want to be ready to have a plan. And they've been doing that for weeks now, and they continue to make really good progress. So I think getting the guidance document from the Department of Public Instruction was really important for them. And having the Compass tool has also been really helpful and important. And I think, they're doing just a ton of planning, and they're getting to very detailed levels to include, things like if a student, shows minor symptoms and it could be associated with COVID, and it's also flu season and cold season, do we send them home immediately, or, how do we handle that student? Do we keep students in small groups or pods so that if someone turns up to be positive, then we quarantine that group of 4 or 5 students? All sorts of just really detailed, creative planning that's happening all around the goal of keeping students and staff as safe as possible when they return.
How should high schools handle student exchange programs for international students when it comes to traveling from here outside of the country?
Yeah, that is a tough one. And honestly, Marcus, I can't directly answer that one. I don't know what level of conversation that the schools have had about those exchange programs. I know that it has come up with higher education as well. And there are a lot of pieces to that. And not, the goal is to be as positive as it can be and as safe as possible for every student. So those are tough situations to make decisions about and balance. And I really can't speak on behalf of the schools as to where they're at with that particular item.
Could you speak on it from a health perspective?
Yeah, well, it depends, Marcus, on if the individual is already here or if they are, if they're coming from another country. If they're coming from another country, which country? Can we bring them in and quarantine them for 2 weeks before they are at school? If we can do some of those things safely, then they're no more risk to others than the general population that's already here. And similarly, if someone from our area is going to another country, same kinds of questions. Right now, La Crosse County, at least, in the last, later last week, we were considered a viral hotspot in the state of Wisconsin. It could have been that if we were sending someone to another country, that we may have been bringing risk to that country. So again, it would be about making sure that we can quarantine that student safely, and that they are, not infectious before they are allowed to go into the school setting. So I think there are ways to do it safely, but there are risks associated with that process, and we just have to be really clear with planning.
I'm not seeing any other questions for you, Jen.
Wow, I'm so impressed with the level of questions. Hopefully I have answered them as much as possible to your satisfaction. We appreciate the questions, and from our residents and our media partners, really grateful for that. I mean, the goal of doing these is to try to answer questions to the best of our ability and to be as transparent as possible. Some of the pieces relating to COVID-19 are hard. They're hard for us as individuals when we can't see family members, or when we see someone else who is engaging in risky behavior and we're taking all the precautions. So there are frustrations at business levels, but there's also a lot of positive happening. And hopefully the launch of the recognition program and Check the Spread, the partnerships, the engagement with our community to be part of the solution. Those are all really promising and positive things that we're doing in our county. And I'm grateful for those things. I think that says that we're willing to make the effort to do what's right and to help us really decrease risk. And we just continue to work on this. We ask that you do the same. And if we continue to work together, we will get through this. And we know that there will be future spikes and surges, and we just want to be as ready as possible for those. And that's where we're at right now, is doing everything we can with the capacity we have to decrease cases and the spread of COVID-19 in our county. Thank you all. Appreciate you. And we will see you next Monday.